Hi guys, Gareth Williams here, Specialist Orthodontist. A number of patients ask me what it's like to have a brace fitted. So I thought I'd make a short video that gives you some of the details, runs you through what to expect so that you're not nervous and you're prepared. So the first thing we do is we pop you back in the chair and we put a little cheek retractor in your mouth, which is similar to cheek retractors that people use when they play the game Say It, Don't Spray It, except ours are sterile. The next stage is that we clean the teeth with a blue gel. We apply it to the outer surfaces of all the teeth and we leave it on for about 20 to 30 seconds, and then we rinse that away using suction to catch the excess that we've rinsed away. Sometimes you will still get a bit of a bad taste. It's not the nicest tasting stuff. It really isn't that flavourful, to be honest, but it's very good at doing its job. So all you've got to do is let us know if you do taste it and we can dilute it with a bit more water. Once that's rinsed away, we then use air to dry the tooth as effectively as we can, and once the tooth is nice and dry, we apply a varnish, which will smell a little bit like nail varnish, but it is not nail varnish. It is a dental type of varnish. Then we blow that varnish with a little bit of air just to disperse it properly around the teeth so that you don't have areas where there's a lot of varnish and areas where there's not a lot of varnish. And then we use a blue light. A lot of people think it's a laser, but it is just a blue light to set or cure that varnish. So what it does is it turns that solution into quite a sticky, tacky substance that makes it easier for us then to be able to stick the squares, or what we call brackets, on. So the nurse will often go around with a blue light for about 20 seconds again. And then the next stage is for us to put the brackets on. So each bracket is very small, probably about 5mm by 5mm, and they either come pre-coated with the glue, with quite a thick glue on the back of the bracket, or my nurse will apply that glue and then we push it on the tooth. Now, just if you're trying to stick two pieces of paper together, for example, if you're sticking two bits of paper together with Pritt stick, you need quite a lot of pressure for that glue to work. So you'll often feel that we're pushing on your teeth a little bit, but that's just trying to get as thin a section of glue as possible so that the bracket can stick to the tooth effectively. The less glue that we get, the more effective the movements of the teeth are, because you've got a really accurate system where there's no give, and the more likely they are to stay on. So we squish each of those squares on. We normally do a quarter of your mouth, what we call a quadrant at a time, just so you can have a little break in between if it's a bit tiring on your jaw being open that long, or some people just don't like lying back for a long period because they feel like they're pooling up with saliva, even though strangely they're often not, but it can just feel like it. Once we've squished those squares on, or placed the brackets as we call it, we then run around with a little probe to get rid of any excess bits of glue that are around those brackets. And then once those are taken away, then it's another dose of the blue light for you, and we set the brackets onto the teeth then. Once we've done either 2 quadrants, so if we're doing an upper or a lower only at this stage, or once we've done 4 quadrants, depending on what our plan is with you, then the next stage is to get the wire and tie the wire into the brackets. Now, the wires are a clever invention. I'll probably do another informational video on wires, because a very common question that I get just as patients are often leaving the surgery, they'll say, "Oh, so how do braces work?" And you think, "Oh, right, that's a very complicated question." It's a multifaceted answer. So the brackets work in a certain way, the glues work in a certain way, and the wires work in a certain way. And then your teeth and roots also work with our braces in a certain way. So what I might do is a series of videos on how braces work by breaking them down into their individual components, if you'd find it interesting. If not, I certainly won't do it. So then we tie the wire into the brackets with colours of your choice if you want colours. If you don't want colours, you can either tell us you want silver, which sort of blends with the brackets if you're under the NHS or you've chosen silver brackets, or black, which don't quite blend as much, but some people think they can be less visible looking if you have black ties rather than silver ties. If you've gone for a clear brace privately, then often the colour that we use to tie those brackets in will be clear elastics. Although sometimes very often actually, people will go for clear braces and then choose coloured ties to go on those brackets then. So that's an interesting one, and to be honest, it looks quite cool. Sometimes if we've put a top and a bottom brace on, because there's a risk of you biting on the lower squares, something we will do sometimes is put a little bit of what we call temporary filling material, but it looks a little bit like chewing gum, on your back bottom teeth to stop you for the first few weeks biting on those squares and either sustaining damage to your teeth, which is very rare, or knocking a bracket off, which is more common. That normally wears down in a couple of weeks' time. It's very temporary and it wears down as you eat. And by the time it's worn down, the lower teeth have moved in such a way, that's tricky to explain, but the lower teeth have moved in such a way that you no longer bite on those squares in any case, because often when we straighten teeth, we actually move, people don't know this and assume it's not the case, but we move teeth up and down as well as back and forth and round and round. Not round and round, round. Once we put that on, we sit you up, we take the retractors out, we give you a good rinse out, and then it's down to you guys. So it'll feel very, very strange at the first appointment. A common finding that people note is that when they try to push their lips together, they can't quite get their lips to meet for the first couple of days, and then that settles naturally. But you'll be pulling this. This is quite a common face I see once we put a brace on. A lot of this going on. Also a tendency to want to play with it with your tongue and play with it with your fingers. I'd encourage you not to do that, guys, because that is how braces come off, and they're not fully set for the first 24 hours, so you really do have to go carefully with them. The first 24 hours are crucial for that brace not to break away. After that, you can be a little bit more relaxed, but they're not welded on there. They are glued on with a fairly weak glue. They have to be, because we need to be able to take them off without damaging your teeth. I do have other videos. I'll put links in the description below on what you should and shouldn't eat when you're in braces. Nobody's perfect. We're not out to have a go at you or make you feel bad or anything like that. But we do have to be moderately strict as well, because if you come in and you keep on breaking the brace, every breakage adds about 2 months to the course of your treatment. And whilst you won't feel it at the start, it's extremely common towards the end of treatment to get, how long have I got left? And it puts me in a position where I have to say, well, you remember those 3 brackets you broke? We'd be done 6 months ago if it wasn't for those. So if you want to avoid all of that conversation and be in and out what we call precision strike orthodontics, and we do get a number of patients who just fly through, don't break the brace. It's a soft diet, good brushing. Anyway, guys, that's all for now. Stay safe and keep smiling.